to having us record this session from beginning to end. So I'm going to show you everything from start to finish. So what we do is we have our patients come in here, they grab a seat in one of our recliners. These recliners, they do fully recline, and they have a heat and massage function, and we actually ordered these off of Amazon. I think the cost was somewhere around $600, so not too bad. We use this monitor here. It's called Contact. That's the brand. It's out of China, and pretty low cost brand. We haven't had any issues with them at all so far. They have 3-lead EKG monitoring, blood pressure, and pulse oximetry. There's also a module you can purchase, an add-on module for a few $100s for end-tidal CO2 monitoring for those pain infusions that tend to potentially get into moderate sedation levels. So at each infusion station we have the monitor. Our pump is over here on the other side. We have an O2 tank for each chair, and right here we keep a nasal cannula, and then we have nasal cannulas with end-tidal on the other side of the room there. We keep an ambu bag next to each patient, and then we actually put an epinephrine emergency kit right here on the wall. So that's got the TB syringe and 1 to 1,000 epi in case we had an anaphylactic reaction. Nobody has to go hunting for the epinephrine and the supplies to draw it up. Be really fast response time. So once a patient gets in here, we hook them up to the monitor, we get their initial set of vital signs. And for those that haven't used the 3-lead EKGs in a while, they all have little letters right here. And so white says RA, so right arm, kind of gives you a hint as far as to where it goes. And it's always the patient's right side. The black says LA, so left arm. And then this one is left lower. So darling, I'll let you stick this one on your side. We'll go on that side. We also do keep ammonia inhalants here in case anybody has a vasovagal reaction to IV start. We keep it taped right here on the monitor. And so you would just pop that, and as the patient's vasovagaling, their blood pressure might drop and they might pass out. So you just let them inhale that under the nose, and it stimulates them to wake up again. We also we have had that happen before, and what we do is we recline the patient flat. We get our IV in as quick as possible, and then just start to bolus them with fluids. It's usually, we've only had it happen twice, and usually the patients will recover spontaneously, but we get that IV in and we give them bolus because it's because they're hypotensive that issue arises. So we'll get our full set of vital signs, and then we'll have our patient fill out our our self-assessment forms. So we have the Beck's anxiety self-assessment form, the Beck's depression, and the neuropathic pain scales are what we use here. So we'll have the patient fill out that before we get started. And so I'll have Darlene do that, and then we'll start the video back up as we're getting the infusion started. So now we're just going to drop our medications for this patient. I have some Zofran here. It's 4 milligrams and 2 mLs, and I pre-medicate my patients who are prone to nausea with some Zofran. I have our ketamine here. This concentration is 50 milligrams per ml. And then I have some Versed here, and I'll pre-medicate the patients that are getting higher doses of ketamine with Versed, and I'll also pre-medicate those that have anxiety, or if they've had a previous issue during their previous infusions with anxiety, then we'll go ahead and pre-medicate them. So we'll draw that up here, and then we'll move over to the patient and get everything started. All right, so to dilute out your ketamine for your syringe pumps, which is what I like to use because the cost is much lower, I just get a bag of either normal saline or lactated ringers. You can mix it in either one. Normally we have smaller bags. You can use a 100cc bag, 250, whatever you like, because this should technically be thrown out after each puncture because there's no preservatives in it. So you're breaking sterility. This needs to be thrown out after each patient. So I have a 60cc syringe here. You don't have to use this. It uses a lot more saline. there was a saline shortage a while back, so you can dilute this into a 10 cc syringe or a 20 cc, or you can even just use a 60 cc syringe and not fill it up all the way. Really just whatever your preference is. So we drew at 0.91 mLs of ketamine, which worked out to 45.6 milligrams using our concentration we have here. So we'll just squirt the ketamine into the syringe. And again, you want to make sure everything's labeled. So I like to write my ketamine in milligrams on my label on my syringe, so I know exactly how much I've been giving each patient. And when you're using a syringe pump, you'll use an IV extension set. We use the microbore tubing. 60 inches works pretty good for us. They come in longer or shorter styles. So we get all this ready before we put the IV in the patient. So we go straight from placing the IV to hooking up our syringe and starting the infusion. We've already checked her vital signs, and vital signs are good, and we've documented that first set. The patient has filled out our pre-infusion questionnaire. We've checked NPO status, double-checked our allergies, and so we're good to go. We'll move over to the patient, we'll get our IV in, and we'll get our infusion started next. Alright, so we have the Medfusion 3500. So you're going to push the power button here. Your first screen you'll get to should look something like this. It takes a few seconds to boot up when you initially push that power screen as it runs through self-checks. But the easiest way to administer your ketamine is on these syringe pumps. It's also the lowest cost way. But what you're going to do is select volume over time. So that's option number 2. You'll pick your brand of syringe. In our case, we have a BD brand syringe. The pump already recognizes that we have a 60 ml syringe in there. If you put a 20 ml, it'll recognize the 20. It's just asking you to verify what it's detecting. So we'll just agree to that by pushing enter. So it's going to ask you the volume to be infused. We diluted our ketamine into 50 mLs. So we have 50 mLs, and there'll be just a tiny bit left over because we added the volume of the ketamine. So we're just going to enter 50 mLs, enter, and then it's asking us for the amount of time we want this delivered over. So for mental health infusions, we're just going to enter 40. So for 40 minutes, we'll push enter. It's letting you verify everything that you just entered. So we're going to give 50 mLs over 40 minutes. It'll count down the time, and then it'll calculate the rate here. By doing it this way, it saves you from having to calculate the rate. It'll do it for you. So once you've verified everything and make sure all your settings are correct, you just push start button, and it will start infusing. And so we'll check in on the video every 15 minutes during our vitals check, and we'll see you in another 15 minutes. Alright, so we're 15 minutes into Darlene's infusion, and so we're just recording another set of vital signs here. Everything looks totally good, vital sign wise. As you can tell, she's alert. When we were documenting on our paper, we document a RASS score, the Richmond Agitation Sedation score. And so for most of your infusions, your scores will be anywhere from +1 to -2 at the most. And that just helps you to document that your patient's not getting to the level that's considered moderate sedation. Once you reach moderate sedation, you have to monitor end-tidal CO2. So Darlene, if you can, I'll just have you tell me your first name.
Darlene.
Your birthday.
10/13/87.
And where are you at right now?
I'm in Albuquerque, New Mexico in the infusion clinic.
Right. And what year is it?
2018.
All right. So as you can tell, she's fully alert and oriented. She's wide awake. At this point, we've delivered about 18, 19 milligrams of ketamine. And how would you describe what you're feeling like right now?
Just light. Light and airy, I guess.
Okay. All right. So this was our 15-minute check-in. We'll check in another 15 minutes. All right. So we're here for our 30-minute check-in. In between, here in the last couple of minutes, Darlene just kind of closed her eyes, although she was wide awake, to verbal stimulus. So as soon as I called her name, she opened her eyes. And now she's here awake again. And so vital signs are still stable. Haven't really seen any changes. Very slight increase in blood pressure. That's about it. So Darlene, we'll just have you tell me your name again
Darlene,
and your birthday.
10/13/87.
And can you tell us where you're at?
Injection infusion clinic.
So as you can tell, her sedation level is increasing just slightly. Her words and her thought process seem to be slowing down just a touch, but still quite easily arousable. I'd probably give her a sedation scale of score of -1, just because right before we started this video she had just dozed off into a very light sleep. So we'll check in once more at 45 minutes. Alright, so we're just doing another check-in here. This is 40 minutes into the infusion. The pump was just stopped, and so we'll do another assessment. Again, vital signs stable. Do see a slight increase in blood pressure. We're up to 127/78, and we had started at 111/67. So slight increase there. Pretty typical. Darling did not fall asleep in between the last clip and this one. So Darling, just have you answer the same questions again. Can you tell me your name?
Darlene,
And when's your birthday?
10/13/87.
And do you know where you are?
Infusion clinic, Albuquerque, New Mexico.
And what year is it?
2018.
And can you describe what you're feeling like right now?
Just like walking on air.
Do you have any nausea?
No.
Okay. So as you can see, she's pretty well awake. She's still alert and oriented. Because she didn't doze off between the last check-in and now, I'd probably move her RAS score back up to 0. So she's alert and oriented. So we'll check in again here as we do another set of vital signs in it'll be about 20 minutes. So this is our final check-in. It's been 20 minutes since we discontinued finished off the infusion. And so vitals are coming down back to normal. Blood pressure's pretty close to where it started off as. Darlene did have a little nausea just a few minutes after we turned off the camera the last time, so we gave her some Zofran. Still hasn't really subsided, so we're going to give her a little bit of Phenergan. We'll start with 6.25 milligrams. So Darlene, do you feel like the ketamine's starting to wear off? Or?
Mm-hmm. Yeah.
And can you just tell me your name?
Darlene.
And your birthday?
10/13/87.
And you know where you are?
Yes, the infusion clinic.
And what year is it?
2018.
And how are you feeling now? Can you describe it?
Just a little nauseous and almost back to normal.
Okay. So the ketamine wears off pretty quick. Usually within 20 to 30 minutes, the patients start to feel like they're pretty well back to normal. You just want to watch them as they leave the clinic, or before they leave the clinic, to make sure that they have a steady gait. We always document steady gait, that they have a ride home. It's usually a good idea to make sure they have a ride home before you start your infusion. But we'll document that as they're leaving also, that they're leaving with somebody who's going to be able to get them home safely. So I hope this video helps everybody actually get a visual on the process of doing a ketamine infusion, and hope you guys enjoyed it.